Hi, I'm Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune. In today's educational video, in our series of videos that we are making on blepharoplasty, I'm going to be talking about tips for recovery. So, you've had your blepharoplasty, and what are the things that you should look out for or do so that your recovery is smooth? So as I had mentioned in one of my earlier videos, eyelid surgery is called blepharoplasty in the medical parlance, and these procedures are done to smoothen out the wrinkles, the folds, or the bags around your eyelid that happen as you age. So let's say you've had an upper eyelid blepharoplasty and a lower eyelid blepharoplasty. Obviously, the post-operative course is much simpler if you're only having either the upper or lower eyelid. Okay, if you're having both the eyelids, it's called as 4-lid surgery, both the upper eyelids and both the lower eyelids. And if you're having 4-lids surgery, then the recovery is a little more tenuous or protracted, and the downtime is a little bit more. But apart from that, it's fairly simple. So if you're just having upper eyelid surgery and your upper eyelid excess skin has been removed and it's been stitched, you will have paper tapes on your eyes and stitches that are removed in 7 days time. Swelling, bruising, a little bit of numbness, a little bit of heaviness in the upper eyelid, difficulty in a little opening or closing. This would be the normal thing to anticipate after an upper eyelid surgery. And your surgeon may recommend gentle massage to encourage the swelling to dissipate in the post-operative period. Eye drops like lubrication, moisturizing, making sure that the eyelid closes when you are asleep. These are important things because you do not want your eyelid to stay open after any blepharoplasty, upper or lower. And if it stays open and your cornea or your conjunctiva is exposed, it will dry, and drying leads to swelling, it leads to watering, it leads to even stormier outcome. So you must ensure that it is staying closed. You can either use a paper tape, you can use shields and ointments, eye ointments, lubricant ointments, so that your eye stays moist. You may be recommended antibacterial eye drops, which are not generally required, but sometimes they are prescribed to prevent any infection around the eyes, and that's for the upper eyelid blepharoplasty. Once the stitches are removed, then massage is all that is required, moisturizing and sunscreen that you normally do use, and you have to just wait for the swelling to dissipate or disappear on its own. Lower eyelid surgery, it's the same. Stitches are removed in around 7 days time. You may have to ensure that you are using your eye drops and eye shields and other things, and making sure that your eyelid is closing. And massage, the massage in an upward and outward direction helps the swelling to dissipate. Apart from that, sometimes for a bruise, your physician or surgeon may recommend arnica, and that seems to help, either taking it orally or applying it locally. That helps the bruise to disappear. And anti-inflammatories and sedative peptidases and proteolytic tablets, they have an empirical value in helping the swelling to resolve. I don't recommend those, but there are quite a few surgeons who do prescribe them on a regular basis. Apart from that, just carry on with the massage. Sometimes the lower eyelid eyelashes may get trimmed or they may shorten, but they'll come back, they'll grow back. There's never an issue with that. Eye may look like it's a little too tight or pulled. There may be watering of the eye because of the muscles going into a dysfunctional state, but it settles down. It sometimes takes 2 to 3 months to settle. Ensure that you are putting lubricant eye drops and sometimes even an antibacterial eye drop. The rarest of rare situation, your surgeon may refer you to an ophthalmologist, and they may recommend some steroid eye drops if the swelling is really bad. But apart from that, there is nothing. Just look out for excessive grittiness or dryness something like a foreign body sensation in the eye. If it has come to that state, then you must get your eye seen by an ophthalmologist or your surgeon, so that appropriate steps can be taken to prevent that from getting worse and to help in that getting cured. Thank you very much for watching this video. Subscribe to our channel so you can keep on getting such educational tips. Thanks.